It's a great day to talk rehab. I'm Dr. DeFabio. Thanks for tuning in. We're continuing our discussion of the rotator cuff muscle. That's the muscle group of the month. Today we're going to be talking about the subscapularis. Again, the rotator cuff is your supraspinatus, infraspinatus, teres minor, and subscapularis. The subscapularis runs along the inside of the wing bone, and it kind of does what this CLX band is doing, is it pulls the humerus down, the arm bone down into the socket. All of your exercises that we talk about for rotator cuff have to be done for this posture. Otherwise, you're just not going to get the results you want. That's the DeFabio difference. It's that simple. So this is an issue. Bringing the shoulders back and down is where you want to be to prevent additional impingement syndromes, bursitis, calcific tendinitis, any sort of irritation to the rotator cuff. You got to get here. So that's why I'm wearing my CLX, just like that, to pull me back and down. Nice little homemade brace, by the way. However, let's talk about how we can strengthen the subscapularis. So, since I got the green band, Mike, grab the red one and come on over here. And we're going to talk about the subscapularis, which was an internal rotator and a depressor of the scapula, humeral head in the socket. Yeah, you can say hi. Go ahead. All right. I'll give you the cue. I'm not going to forget. Don't worry. I won't throw you under the bus. So the subscapularis sets the humerus in the wing bone. Really important. Most people do the external rotators. Most people do the supraspinatus, infraspinatus, and teres. A lot of people forget about the subscap, so let's talk about it. All right? So again, it's going to be an internal rotator. It rides in through here. It's going to pull in. In the beginning, the best way to do it, start off sideline. If you have a rotator injury, cuff injury, you may be doing external rotations. Well, do internal rotations. Go face up. Sideline, you can also do it. All right, so turn towards me. That was my fault. So you take your CLX band, loop it over one hand. Here you're going to need the door anchor for the CLX, okay? Or if you have somebody like me that would be your coach, they can step on it, okay? But the door anchor will loop right through it. And then stack everything, the shoulders, keep the head supported, a neutral spine, and rotate in. Hold 1, 2, slowly go out. It's real important that the CLX, again, is in line, the elastic tubing is in line with the forearm, just like any other weight you'd be lifting or carrying, and it will duplicate isotonic resistance. Properly used, elastic resistance creates the exact same strength curve as weight training. All right? So, that's number one. Number two, come on up for us. I'll be the door anchor. So you can stand, actually, no, I got to go over this way to be the door anchor. We're going to dance today. So internal rotation. Now, same thing with internal rotation as we did with external rotation. A small pillow, rolled up towel, about 20 degrees, get that arm bone humerus off, and that's anatomical neutral, and turn it. Hold 1, 2, and then slowly go out. Yeah, keep that pinned in there. 1, 2, slowly go out. And again, if you use the door anchor, it just loops through this, and it just goes through the door. And that's how it works for CLX at home, okay? Now, what we want to do, eccentric loading. Eccentric loading, again, is for tendinosis, tendinitis, or to work around the pain. This is a little bit different. So I'm the door, so what you're going to do is step away and then slowly let it come out. Then recover. No tension. Concentrically load, then slowly let it out. No tension, concentrically, and slowly let it go out. However, our life isn't here. So many things, especially throwing sports, are up and through here. And again, as soon as that arm comes up, that subscapularis has got to engage to keep the humerus in the good anatomic alignment in the socket, so we have to train overhead activities as well. Let's go face up, please. To train overhead, elbow, shoulder, hand, all at 90-90. You got your door anchor, and slowly turn down. Real important with this alignment at 90-90. Come on up and turn down. Okay? And come up And there you go. That's your internal rotation. When that gets easy, when I say easy, you're doing 3 sets of 15 to 20 twice a day and it's not bothering your condition, stand please. Then, and only then, you can go to doing it standing. So you're going to be up, actually, you're going to be 90-90 here. Okay. Again, you're going to need you need the door anchor for subscapularis. And go ahead and turn in. And notice how the shoulder is level. It's not riding up. The elbow is level. It's not dipping, okay? It's 90-90, and you're just working that subscap. If you want to work 90-90, excuse me, you're choking me up, Mike. If you want to work 90-90 in an eccentric phase, right? You start here, step forward, and slowly recover. Now step away, release all the tension, right? Set, step forward, slowly. And that's a lot of load on the subscapularis, eccentric loading at 90-90 position. CLX bands, great Mike, thanks a lot, are a great way to do all of this at home. Used properly, they will duplicate the same strength curve as isotonic weight resistance. Your 4 rotator cuff muscles, your supraspinatus, infraspinatus, teres minor, subscapularis all have to be balanced, all have to be strong, and if you're an athlete, need to be able to do that eccentric, because eccentric loading is what reduces your risk for non-contact injuries, for deceleration. You throw your arm out because the muscles aren't strong enough to hold it in. Deceleration is important. If you have more information on which exercise is going to be the one you need, or is your problem a rotator cuff issue, hey, watch my clinical rounds issue on shoulder examination. I'm Dr. Donald DeFabio. It's been a great day to talk rehab. Thanks for tuning in. I appreciate your support, and hey, share me. Have a great day.